Hello everybody. Thank you very much for this kind invitation to share some words in this scenario the mission brings. I am very proud of this project with great friends in this great journey to work for the other people, to share our knowledge, to share our experience, but especially to share our human being sensibility. In this time, I like to say again about my recognition and thank you to the team in the different parts of the project for the preparation of the schedule, surgical work, conference, support to students, support our residents, and support especially for the people. My few words is related to the first announce about this event I put in Twitter and I like to share with you. Many years ago, we started the dream of sharing medical knowledge and care with the generosity of the world leaders in neurosurgery. Now, in times of pandemic, we continue with this vocation. And part of this presentation, I like to share with you my last paper related with COVID and the pandemic times. This is the name of the subsequent cures of the COVID in the society. It was published in this week in Archives of Medical Research from Elsevier. And I like to share some words about this paper with you because it's part of the contemporary scenario for all people in the world. Beyond the strict biological scenarios inherent to the virus, other consequences exist that require attention for us. This is related to the alternative implication of the pandemic in our society. In the first time, our primary focus, of course, will be oriented to the treatment of the disease, to management of the consequences of the infection of the virus, and this is directly related with the physical deterioration of the patients. The accuracy of the natural history of diseases, the containment, the mitigation strategies is part of the great work in all worlds. Additionally, we research about the eager search for remedial alternatives and the future of the vaccines. In the second curve, we need think in the other scenarios. The deferral of the elective procedures of the chronic disease and even some non-COVID infection have started to have an impact on the numerous cases. One third curve is related with the social consequences and comprise of the official regulations of the confinement and eventual suspension of non-essential activities and their consequences. This situation have repercussions in local employment and economy. We have a fourth curve related with the physical and mental conditions of the professionals of health and the people. We have many days in confinement and now we have consequences directed with the anxiety, depression, uncertainty, and related with the mental consequences of the physical disease. This situation have an impact in healthcare professionals. We know the burnout syndrome with different repercussions in the mental condition and emotional situation and the physical situation of our professionals. We need to think about the quarantine related to the physical separation of the people who have been exposed to an infectious disease. But the isolation is related to the strictly applied to persons that suffer with the infection. It is important comment about the isolation is in the physical distance, but not necessarily related with the social distance, because now we have more necessity to work and state together, all together by different ways. Like this way, we are worked in this project, this delay project as Mission Brain. Consequently, the instruction of the sanitary structure in different parts of the world must be sustained in legal basis. Authorities must be solid, convincing, scientifically supported, respecting of civil rights without becoming a state of emergency. The current interpretation related with the immunity passport, which is obtained through diagnosis, laboratory diagnosis, can be achieved in different scenarios. The situation today in the world, the disease, inherent social risk, and the environmental context in the disease risk itself. The relevance of the bioethics is now in the table for the make decisions, because the position and the vocation of the bioethics is preserving the fundamental rights in a crisis scenario related with the looking for the critical roots and to get a greater balance and a part of discretionary decisions. Certainly, many collaterals have emerged from these curves, and in the case of the challenges, new challenges is related with the convert the aspirational precepts to proactive proposals basis what are now called more determinants of health. This is to say that the right to the life, the right to the health, have a universal character inherent to dignity without the interpretative confusions of any state in the world. The respect of the physical and emotional integrity for our patients and for the people is a new challenger and among the people and the society. These sanitary guidelines must not be the cause of the social discrimination or stigma that can be associated with the management of such data, and in any case take in account the moral determinants of health and the social determinants of health in the make decision for a specific socio-cultural context. It is the permanent task of the bioethics to anticipate these conditions. This approach are particularly oriented to those who are primarily responsible for decision making in matters with an impact in public health. With this message and with this idea, this project Mission Brain touch the feeling and touch the respect for the people to work in this altruism project for the future. We are in a project related with the education, with the moral values, with the principles, with the deontological codes and ethical codes. For this reason, it's for me a pleasure have the opportunity to refresh these foundational principles of our project related with the Mission Brain. Thank you again for this kind invitation, and I send for you my best wishes for your health and for your country, and we are working in the same project and in the same way. Thank you again. I see you.